Welcome back to the channel. And if you're new here, welcome. This channel is dedicated entirely to helping seniors like you live longer, healthier, and more comfortable lives. If that's something you care about, and I know it is, make sure you hit that subscribe button right now. We post new health tips every single week. Today, we're talking about something that affects nearly half of all adults over the age of 60 in the United States. And yet, it is one of the most overlooked health issues in senior care. We are talking about poor leg circulation. Now, don't let that phrase scare you. In simple words, it just means that the blood isn't flowing as well as it should through the blood vessels in your legs and feet. Warm. And here's the encouraging news, and this is exactly why I want you to keep watching. You don't have to just accept this. There is something you can do, right now, today. No equipment, no gym membership, no fancy gadgets. Let's start from the beginning. 3. Why leg circulation gets worse after 60. Slow, educating tone, like a trusted doctor explaining clearly. First, let's understand what's actually happening inside your body, because once you understand it, everything else will make perfect sense. Your heart pumps blood down to your legs through arteries. That part is easy. Gravity helps. But the real challenge is getting that blood back up to your heart through your veins. That journey goes against gravity. Your body has a very clever system to make this happen. Your leg muscles, especially the calf muscles, act like a second pump. Every time you take a step, every time you bend your knee, those muscles squeeze the veins and push the blood upward. Doctors actually call this the calf muscle pump, and it is incredibly important. But here's the problem that starts showing up after 60. Number 1, we sit more. Many seniors spend a lot of time sitting, watching television, reading, riding in a car, or recovering from an illness. When you're sitting still, that calf muscle pump isn't working. Blood starts to pool in the lower legs. Number 2, muscle mass decreases. After the age of 60, we naturally begin to lose muscle mass. Weaker muscles mean a weaker calf pump. Number 3, vein valves weaken. The tiny valves inside your veins, the ones that keep blood from flowing backwards, become less effective with age. This leads to blood having a harder time getting back up to the heart. Number 4, the arterial walls stiffen. Conditions like high blood pressure, diabetes, and high cholesterol cause the walls of the blood vessels to become stiffer and narrower over time. When you combine all 4 of these factors together, you get a very common scenario: a senior who is struggling with poor leg circulation and often doesn't even realize it. 7. Warning signs you must not ignore. Slow, gentle, but serious. Caring, not alarming. So how do you know if your circulation is being affected? Let's go through the warning signs right now. Warning. Sign number 1. Swollen ankles or feet, especially in the evening. Many seniors notice their shoes feel tighter by the end of the day. This is called edema, fluid building up in the tissues because blood isn't draining properly from the legs. Warning sign number 2. Leg cramps, especially at night. Those painful muscle spasms that wake you up at 2 in the morning, they are often a sign that blood flow and oxygen delivery to the leg muscles is reduced. Warning. Sign number 3. Heaviness or fatigue in the legs. Does walking even short distances leave your legs feeling like lead weights? That exhaustion is your muscles crying out for more oxygen-rich blood. Warning. Sign number 4. Tingling, numbness, or a pins and needles feeling. When blood flow is restricted, the nerves in your feet and lower legs can be affected. That strange buzzing or numb sensation. Don't brush it off. Warning. Sign. Number 5. Cold feet, even in warm weather. If your feet feel consistently cold, even when the rest of your body is warm, that is often a sign of reduced blood flow to the extremities. Warning. Sign number 6. Skin changes on the lower legs. Look at the skin around your calves and ankles. Discoloration, a brownish or reddish tint, thickening of the skin, or sores that are slow to heal are all serious warning signs. Swollen, twisted, blue or purple veins visible under the skin are not just a cosmetic issue. They are a visible sign that your vein valves are not working properly. Here's something very important. Many seniors ignore these signs, thinking it's just a normal part of aging. Please don't make that mistake. These symptoms are your body's way of asking for help. 05. Engagement moment. Speak to the heart. Slow, warm, direct, sincere eye contact with camera. Lower energy slightly. I want to stop here for just a moment. If you are over 60, or if you are watching this because you care for an elderly parent, grandparent, or loved one, this information could be life-saving. Poor leg circulation isn't just uncomfortable. Left untreated, it can lead to blood clots, deep vein thrombosis, and in the most serious cases, stroke, pulmonary embolism, or limb loss. So please, if you recognize any of those warning signs in yourself or a loved one, take this seriously. Talk to a doctor and keep watching, because what I'm about to share is something every senior needs to know. 06. The one exercise surgeons recommend: warm, urgent, upbeat, hopeful energy. This is the payoff. All right, now for the part you've been waiting for. Vascular surgeons, the doctors who specialize in blood vessels, have long known about one particular exercise that directly activates the calf muscle pump we talked about. It's simple, it's safe, it can be done sitting down if needed, and study after study has confirmed its benefits for seniors. Pause. Slow. That exercise is called the ankle pump, and its more advanced version, the calf raise. Now, I know what some of you might be thinking. That sounds too simple, but please, stay with me, because the science behind this is remarkable. Exercise 1. The ankle pump. Seated. Slow. Walk them through it step by step. This is the gentlest version. It is recommended by surgeons for seniors recovering from surgery, those with severe arthritis, or anyone who has difficulty standing. Here is how to do it. Slow. 1. Sit comfortably in a sturdy chair with your feet flat on the floor. 2. Now slowly lift the front of your foot, your toes, upward toward your shin, while keeping your heel on the ground. Hold for 2 seconds. 3. Then slowly point your toes downward toward the floor, like you're pressing a gas pedal. Hold for 2 seconds. 4. That is 1 repetition. 5. Do this 15 to 20 times on each foot, then rest for 30 seconds, then do another set. Beat while warm. What's happening inside your body when you do this? Each time you flex and extend your ankle, you're contracting the calf muscle and squeezing the deep veins of the leg. This pushes pooled blood upward, back toward the heart. It's like manually activating your body's own natural blood pump. Vascular surgeons actually recommend ankle pumps to patients on bed rest in hospitals, because they are that effective at preventing dangerous blood clots. Exercise 2. The calf raise, standing. Warm, slightly more energetic. This is the gold standard. For seniors who are able to stand safely, this is the gold standard exercise for leg circulation, and the results can be truly impressive. Pause. Slow. Here is how to do it. 1. Stand behind a sturdy chair, counter, or wall. Hold on lightly for balance. 2. With your feet hip-width apart, slowly rise up onto your tiptoes as high as you comfortably can. 3. Hold at the top for 2 to 3 seconds. Feel that squeeze in your calf muscles. 4. Then slowly lower back down to the floor. 5. That is 1 repetition. Start with 10. Work your way up to 20 to 30 repetitions over the coming weeks. Aim for 2 to 3 sets per day. Slow, urgent. Emphasize this point. The key word here is slowly. The slow, controlled movement is what makes this exercise so effective. A fast calf raise barely engages the pump. A slow, deliberate one activates the entire calf muscle and creates maximum blood-pushing force. When and how often should you do this? Warm, practical guidance. Reassuring pace. Morning routine. Do 1 set of 20 ankle pumps in bed before you even get up. Blood tends to pool overnight. This gets things moving right away. Throughout the day, every hour that you've been sitting, do a quick set of 20 ankle pumps. Set a gentle reminder on your phone if that helps. After meals, after lunch or dinner, do 15 to 20 standing calf raises while holding your kitchen counter. Many seniors find this the easiest time to remember. Before bed, end the day with one final set of ankle pumps to drain any fluid that built up in your legs during the day. Warm. Total time commitment? Less than 10 minutes. Spread gently throughout your day. 12 hours, 15, 30. Supporting habits. Row 7. 7 habits that supercharge your circulation. Warm. Encouraging, practical, like a knowledgeable friend. The ankle pump and calf raise are your secret weapons, but they work even better when combined with a few simple lifestyle habits. Let me share the most powerful ones. Habit 1. Elevate your legs in the evening. When you relax in the evening, try propping your legs up so that your feet are above the level of your heart. You can use pillows, a footstool, or a recliner. Even 20 to 30 minutes of leg elevation can dramatically reduce swelling and help blood drain back upward. Habit 2. Stay hydrated. Dehydration makes your blood thicker and stickier, which makes it harder to flow through your blood vessels. Aim for 6 to 8 glasses of water a day. Herbal teas count too. Coffee and alcohol, on the other hand, can dehydrate you, so enjoy those in moderation. Habit 3. Compression socks. Compression stockings, available at any pharmacy, are one of the most effective tools for managing poor leg circulation. They apply gentle, graduated pressure to the legs, which helps squeeze blood upward and prevents pooling. Talk to your doctor about what level of compression is right for you. Habit 4. Walk every day. Walk. Walking is, quite simply, the most natural and effective circulation booster there is. A gentle 15 to 20-minute walk each day, even broken into smaller 5-minute sessions, can make a significant difference. If walking outdoors is difficult, walking around your home works just as well. Habit 5. Eat for circulation. Certain foods are powerful natural circulation boosters. Try to include more leafy greens like spinach and kale, beets, berries, fatty fish like salmon, garlic, and, yes, small amounts of dark chocolate. These foods help dilate blood vessels, protect vein walls, and keep the blood from becoming too thick. Habit 6. Avoid sitting cross-legged. Sitting with one leg crossed over the other compresses the blood vessels behind the knee and significantly restricts blood flow. Try to keep both feet flat on the floor whenever you're sitting. Habit 7. Quit smoking. If you smoke, this is the single most important thing you can do for your circulation. Smoking damages the lining of blood vessels, causes them to constrict, and dramatically accelerates the hardening of arteries. Your doctor can help you find the right cessation program. Row 8. When to see a doctor: immediately, slow, serious. Calm and authoritative, not scary, responsible. Now, while everything I've shared today is safe and beneficial for most seniors, there are certain situations where you must see a doctor right away. Not tomorrow, not next week, immediately. Read each point clearly and with gravity. Sudden, severe pain in one leg, especially if combined with swelling, redness, or warmth. This could be a sign of a blood clot, which can be life-threatening, a leg wound or sore that isn't healing. This may indicate dangerously restricted blood flow and requires urgent evaluation. Sudden numbness or weakness in one leg, especially if accompanied by dizziness, confusion, or difficulty speaking. These can be signs of a stroke. A leg that becomes pale, cold, and painful very suddenly. This may indicate a sudden arterial blockage, which is a medical emergency. Please don't brush these signs off. And please share this information with anyone you love who is over 60. You may be doing them the greatest favor of their life. Row 9. Real stories. You are not alone. Warm, storytelling voice, gentle and heartfelt. I want to take a moment to share something that keeps coming up in the comments on this channel. We hear from seniors all the time who say things like, slow. I thought swollen ankles was just part of getting older. My doctor told me to walk more, but never explained why. I had no idea those nighttime leg cramps meant something serious. And what breaks my heart is how many seniors suffer in silence because they don't want to worry their families, or because they assume nothing can be done. If that's you, I want you to hear this clearly. Something can be done. You are not powerless. Your body is more capable of healing and improving than you may have been led to believe. Warm storytelling. Paint the picture. A 73-year-old viewer named Margaret from Ohio told us she had been struggling with swollen ankles and leg cramps for years. After watching a video on this channel, she started doing calf raises twice a day and walking 15 minutes after dinner. Within 6 weeks, her ankles were noticeably less swollen, her sleep improved, and for the first time in years, she was able to walk around her grandchildren's school play without needing to sit down every few minutes. Beat. Warm, small changes, consistent effort, real results. That could be your story too. 10. Special note for seniors with diabetes. Slow. Warm extra care in tone here. Many in audience may have diabetes. A quick but important note for our viewers who are managing diabetes, because circulation problems are especially common and especially serious in diabetic seniors. Pause. High blood sugar over time damages the walls of blood vessels and nerves. This is why diabetic seniors are at higher risk for poor healing, foot ulcers, and in severe cases, amputation. Everything in this video still applies to you, but with a few extra precautions. 1. Inspect your feet every single day. Look between your toes, at the soles, and around the heels for any cuts, blisters, or sores. Reduced sensation means you might not feel an injury that could become serious. 2. Keep your blood sugar as well controlled as possible in consultation with your doctor. 3. Talk to your doctor before starting any new exercise routine, especially if you have neuropathy, as balance may be affected. 4. Never exercise in bare feet. Always wear properly fitted, protective footwear. 11. Summary. Bring it all together. Warm. Urgent, uplifting energy. Like a coach sending the team back onto the field. All right, let's bring it all together. After the age of 60, leg circulation naturally becomes less efficient due to weaker calf muscles, aging vein valves, and conditions like hypertension and diabetes. The result? Swelling, cramping, heaviness, numbness, and discomfort in the legs. The number one exercise recommended by vascular surgeons to fight this is the calf raise, or for those who prefer a seated option, the ankle pump. Both directly activate the calf muscle pump, pushing blood back up toward the heart. Pause. Warm. Combined with daily walking, leg elevation, staying hydrated, compression socks, and a circulation-friendly diet, these steps can produce meaningful, noticeable, and remember the warning signs that require an immediate doctor's visit: sudden one-sided leg pain and swelling, non-healing sores, and any sudden neurological symptoms. Beat. Warm. Your legs have carried you through decades of life. It is time to take care of them. 20-30. 21. Outrow and call to action. 12. Outrow, call to action, warm. Direct, sincere, eye contact, smile, speak from the heart. If this video helped you, if it taught you something new, made you feel less alone, or motivated you to take action, please hit that thumbs up button right now. It takes 1 second, and it helps this information reach other seniors who need it. Beat. And if you have a parent, grandparent, sibling, or friend over 60, share this video with them today. You might be sharing something that changes their life. Pause. Warm. Drop a comment below and tell us, do you experience any of these circulation symptoms? Have you ever tried ankle pumps or calf raises? We read every single comment, and we love hearing from this incredible community. Beat. And if you haven't subscribed yet, please do. Click that subscribe button and turn on the notification bell so you never miss a new video. Every week we bring you the latest, most practical, most trusted health tips designed specifically for seniors and their families. Slow, warm, final line, let it land. Because at this channel, we believe getting older doesn't mean getting less. It means getting wiser and healthier, one step at a time. Warm. Slow. Take care of yourself. We'll see you in the next one.